There is an enormous difference in the reported mortality of this virus from South Korea testing vastly more, much lower percentage of the population that has died from it, well under 1%, as opposed to in Italy, where we're talking, over 5%.
Some places 8.
Right, Iran, for example. Obviously, testing regime is a big part of this, but there's a question of what kind of population, there's pollution in the atmosphere, there's how old you are, there's density. Given all of your expertise, where do you think mortality, once we get testing truly up and running in this country, where do you think we probably are heading on that question?
Well, Ian, I think actually it's going to vary dramatically across the country. We have a very patchwork system in the United States, and I think if you'll allow me, I need to step back for a moment and explain how we got to this mess. Most of the public health systems arose by dictate from the ruler. In Europe, for example, it would be the kings, this and that, the queens, yada, yada. And so the rules and regulations of public health came from the top down. The United States was 100% the reverse. Everything arose from the bottom up.
Everything's different.
And it's different wherever you go. You cross state lines, you have a completely different public health system. The rules and regulations are all different. Inside of some states, you cross county lines and there's differences. And so the first thing that will be very different is the nature of the sort of power structure within public health in a given state. The second thing is some states have essentially opted out of Obamacare. They've made the ceiling for qualifying for, or the basement, if you will, for qualifying for Medicaid so low that you have to be in dire poverty to get into Medicaid. So they have a huge percentage of their population that's sort of working class and lower middle class that doesn't have health insurance and doesn't have access to their system.
So are you saying that it is feasible, even likely, that in some parts of the United States you will see Lombardy-style mortality rates from this disease?
Yeah, I think that will be so in certain parts of the country. And then in other parts of the country, it'll be quite the reverse. I mean, I think if you're right now in San Francisco, where they are pulling out all the stops as we speak, they've literally shut the city down. They've told everybody,
stay in your homes.
Yeah, it's possible that they will keep their mortality rate relatively low, that they will be successful in holding it below 2%. But then you may get to some other locations. I don't want to name one because I don't want to be accused of smearing a population, but there are certainly places where you have large concentrations of elderly who have moved there for retirement, where you have many of them living in co-housing facilities or in gated communities, where elderly see elderly all day long, and where their caretakers may be underpaid and in some cases be immigrant labor. Those are dynamics that call for some really strong intervention from government, or you're going to have a disaster there.